Welcome to Our Time. Our guest this week is a dentist, and we're going to show her face, contrary to the TV commercial selling both toothpaste and dental care. Welcome, Anna Koutsonikos.
Very well done.
Thank you very much.
You did very well.
I practiced your name.
You did.
Because
I could tell.
The truth is, when you see dentists, you often don't, you call Mr. or Ms. Dentist?
Yes, or I guess if you've known them over the years, you just call them by their first name, which
Anna.
is how you call me. Yes,
I do.
Anna, yes.
Because you're actually my dentist.
That's right, I am, yes.
And do you know why you're my dentist?
You can tell me why I'm your dentist.
Because you've got small hands.
Yes, I do, yes.
And that's what really interested me coming to you as a dentist. And I'm not doing a commercial for you as a dentist.
No.
I'm just saying it how it is, because you were the first female dentist I'd ever had.
Okay.
And I've had dental work since I was a child, because I had rotten teeth as a kid. And it was always male dentists. And we never thought of dentists being female.
You were coming to the practice though for many years before I saw you. Yes.
To a dentist, John, who I've actually had on the program years ago. But the reality is we don't generally, we didn't is the point, generally have female dentists. What made you want to be a dentist?
I don't know what
because you had teeth.
Yeah, the light bulb moment was, but once I realised that's what I wanted to do, it just all seemed to make sense to me. I grew up in a very small country Mallee town.
Oh, did you?
Oyen in northwest Victoria.
Right.
We were the only Greek family there. Wonderful town, wonderful. And having heard you say my name or try to say my name, my dad actually shortened our name in the years that we were there. So it was actually Nikos. So the locals could pronounce the name.
Okay.
So I actually didn't revert back to Koutsonikos until I came to Adelaide to go to uni. So so I just remembered that actually when you were trying to say it. So nowadays we would never, shorten the name. I think most people could pronounce it easily.
Absolutely. And also with other cultures coming into the country.
That's right.
Like
it's a lot
Indian
different.
names
It's
are
a lot
quite long.
different. So yes, there was a lovely dentist in Oyen. The dental surgery was attached to the hospital.
Male or female?
He was male, but lovely, and from Adelaide.
Not saying male dentists aren't lovely.
No, of course.
Their hands
They're
are
all,
too big.
yes. They're, but year 11 work experience, I had spent some time with him, and it really it went from there. So
isn't that so special that people inspire you?
Yes.
It can be school teachers, it can be somebody like yourself that you've gone to.
Yep.
I mean, how many, and you won't know the answer to this, but it's like how many of your patients have you inspired to look at dentistry as a profession?
Well, I don't know.
No.
I don't know.
But that's the point, isn't it?
It's certainly nice to think that you might have just made them feel more comfortable in coming to see you. Whether I've inspired anybody to, as a profession, I don't know.
None of us know those things, do we?
It's certainly something that you were talking about female dentists as well. I mean, in my year, there were more females than male dentists. This was in the mid-80s, so I'm not sure what the number. I think it's fairly 50-50, fairly even now. So,
but it's like there weren't that many female doctors either. There weren't many professional people in the medical profession who were female years ago when I was young.
Yes.
So those young impressions that you have, you tend to carry through life.
That's right.
Obviously.
That's right.
Okay, so just so people understand what goes into a dentist's learning life, how did you start? How long did it take? Where did you do it?
Yeah, it was a 5-year degree. So that sort of took up most of the 80s for me. I finished in 1989. There was a residency at the hospital at the time for the next 2 years that it was great, actually. There were a lot of specialists working at the hospital, and we were doing, a lot of hours and learning a lot.
So that was more medical stuff?
No, just general dental, just spending time with each specialty and with specialists. So, and a good grounding. I then I spent some time overseas working. I came back, I did my fellowship in the Royal Australasian College of Dental Surgeons. That's an examination. Quite a lot of hours went into that.
I'm sure. Because you have to know more than teeth.
Yes, you do have to know more than teeth. That's right, that's right. It all leads to teeth in the end, yes. But yes, it's all that background that you need to know. I did a specialist qualification in 95 and 96, so I'm a prosthodontist. I do work in general practice as well. But
just say that again, you're a...
prosthodontist. That might be a bit easier than...
literal definition to say,
so that's, you say it. I guess, prosthetics for the mouth, really. So if you think, you know, crowns and bridges and implants and dentures, though we don't do so many dentures.
No, that's fortunately a thing of the past. Again, when I was a kid, often when people got married in their early 20s, they ripped out all their teeth.
That's
what
right.
A dumb thing to do.
And I still have ladies who say that, or they've known someone who had their teeth taken out as a wedding present.
Yeah, I know.
Which you just can't get your head around these days. Yes, I know. So that's, you know, a lifelong then of false teeth.
Of false teeth,
yes. So.
And as the bones in your head change slightly, suddenly the teeth fall out when you're talking. That's right.
And yes, it's a challenge for them towards for many years, really, for their whole life.
I remember back in the days of black and white television, the ads for the stuff you put in the false teeth to stick them up again.
Yes, that's right.
Good that those days are gone.
I know. There's still a bit of that to play. I mean, we have, you know, you had Steve Zakoulis on the program talking about implants. Yes. Fantastic, but it's you know, it still is.
Well, it's an expensive item across the board.
It is.
Because it's a medical procedure.
That's right. That's right. There's a lot that goes into it, so it's not for everybody. It would be great to take the finances out of the equation and be able to offer it to everybody.
But it's life, isn't it?
That's right.
Everyone's got to live.
And so we go through, you know, treatment planning options of 1, 2, 3, 4 and see what best suits. But yeah.
But the reality is you're changing something in the human body and you don't want to change it badly.
No.
Or unhealthily.
No, that's right. And you're always looking for the long-term outcome. It's patients that you want to come back for many years and that you've done, you know, a positive thing for them.
You're looking after them.
That's right. And you hope that they come back to see you and you're having a look and seeing what treatment that you've, you know, offered, and it's
and that it's been successful.
That's right. That's right. So, and not the same for everybody, but it's good in practice over many years to get to know people.
Oh, absolutely.
It's lovely.
There's security though.
That's right.
We were joking before about like walking into your surgery and you see all the implements there, and you might see a syringe there ready to try and help you forget the pain or whatever.
What's going on?
And people are nervous. Just explain coming into the studio to me.
Oh, today? Well, it's similar, and I think that's a bit of payback from you.
Never.
It is. It does. It puts you in a. I guess because you've got to sort of come in and it's not an area where you're in control really. Whereas when you come to see me, I'm in control of that.
No, but
that
you're
situation.
In control now because we're all listening to you.
Yes, okay, you are listening to me. So yes. So it is.
No, but isn't
similar.
that the truth? But
it is
when we go to something that's different for us, and the reason I'm going down this path is because it shouldn't be a fearful thing. You should rejoice in the fact that somebody can actually improve your life, because that's what it boils down to.
That's right. That's right, and it really depends. Everyone is different. Everyone's had different experiences. It's just everybody sort of interprets things on what's happened in their past. So you need to assess that when someone's come in, you've met them for the first time. You sort of can ask some questions and just find out how someone feels. That's right. That's right. So,
and the fact that if you've got somebody that you're going to regularly it means that you do form a relationship.
That's right.
And you've got the chance of looking at their notes beforehand to know what happened. Oh, how is that I did
yes,
for you before?
Exactly.
Or the X-ray.
Yeah. And it's nice to, or other things too, you know, people have been away, or it's nice to be able to remember that. It's just a bit of chatter, but you know, I always hope that it just
But
relaxes
chatter is
people.
important, isn't it? Because we're all human at the end of the day.
Yeah.
And you're as human as anybody else. And we're going to come back in a minute and talk about your human, but also just some tips that as a dentist you give people to look after their teeth and what to do in the case of.
Look,
we'll come back.
Okay, all right, okay, I shall do that.
And we'll be back to talk more with Anna in just a moment. Anna Koutsonikos is my guest, and she's a dentist. We were talking before about, you know, what leads up to becoming a dentist and being in practice. But over the years, you must have picked up on a lot of things that you can advise people on to look after their teeth better.
Yes.
So can we start from young children with their first teeth that comes through?
Well,
how can parents really look after their teeth? Because little kids don't particularly want to have a scrubbing brush in their mouth.
That's right. And it's all about diligence with that and just repetition really, so that they get used to using a toothbrush and getting to the stage where they you know, they need to be brushing their teeth.
They just
really.
do it as
they just do it, exactly.
Before I go to bed
That's
or whatever.
right, that's right.
Is there a rule of thumb as to the best time of the day to brush your teeth?
Not really. We're still sticking to probably the morning and, you know, at night as well.
Before you go to bed.
Before
so
you go to bed. Yes,
that
that's right.
eating.
That's right. And diet's important across the board with any age. But parents have that role, I think, to play with diet, with young children,
food.
especially.
Is milk still an important product?
Milk? It can be. In what way, though?
Oh, just in, you know, formation of the teeth, growing teeth?
Oh, it's something...
What's the most important foods for teeth?
Well, teeth, because they're already... the developmental part is already it's already there. So really, it's all about fluoride in the water. Obviously, fluoride not for the young ones.
But that's already in our water supply.
That's right, and that's why there's a whole generation of young people with fantastic teeth and hardly any decay these days.
Yes, well, certainly I didn't have that advantage.
That's
As a kid, I drank rainwater.
Yes, so there will be a significant difference in the teeth. There are other things to sort of watch out for. I mean, everyone knows about sugar. Really, the dental education has been fantastic with that. It's other issues now, you know, with the sports drinks and the acid, and people just
well, there's
need
a lot
to
of sugar in the sports drinks.
It's more the acid.
The acid.
So it actually just washes over the teeth and erodes the enamel. So it's a different pattern of tooth wear. So it's different to decay that you get from sugar in the diet.
So it's like the enamel is being worn off through the acid, the acidic reaction.
So it's quite a different wear pattern of teeth. So
and most of the sort of fizzy drinks have those acids in them.
Yes, yeah. There'll be some that, like Coca-Cola, will have the acidic component. A lot of people say, well, I drink Diet Coke, or that's fine, there's no sugar, but there's still acid in there, which is doing damage.
Right. So when we just said before about the sugar component, is it because the sugar has an acidic reaction as well?
No, it's the two have just a different effect on tooth
so you're
enamel.
challenging your teeth whatever way you go.
That's right. So, but things people may not be so aware of, and things like soft drinks, it's just the frequency of if you're sipping...
Drink every day.
Yeah,
lots.
or for many hours during the day, it just doesn't give your saliva enough time to recover.
And your saliva basically cleans your teeth?
It does. It's a buffer, but it takes about half an hour to get to do its job properly. So then if you have...
So you should do that a lot?
Well, if you have a sip of Coke, say, and then 10 minutes you have another sip of Coke, the saliva is unable to buffer that acid.
Okay.
So that's where the damage happens.
Fair enough. So we're growing up and we've lost our so-called baby teeth. Is there another name for that?
No, well, primary dentition,
teeth.
yes, yeah, primary dentition.
And your other teeth are already sort of buds are already there to push through.
Yeah.
What's by this time you're hopeful that children will have got into the habit of just brushing their teeth without prodding?
That's right, and that diet is somewhere on the on the agenda. People are a bit aware, but it is about brushing your teeth. Diet is very important. I mean, if your diet is not good, you can brush your teeth many times a day, but you'll still get some sort of...
When you're saying is your diet not good, you're talking about proper fruit and vegetables that are fresh.
Yes.
And meats.
All those things.
Yeah,
it's just really...
it's the processed food,
it's the frequency of consumption of sugar or acid in your diet.
Okay. So as we age, at what age do we generally start needing fillings and things in our teeth?
Well,
Is
that
there
can
a
happen
commonality?
that can happen from infants really with their primary dentition. If they're sucking on a milk bottle overnight, they'll get decay. So that's when you were alluding to milk before, because that's got a sugar in it.
Right. So if you can't get somewhere to clean your teeth, the old saying used to be was chewing gum. Does that help? It
can do sugar-free gum as long as it can stimulate the saliva. But again...
Is that what it really does though? It's only about stimulation.
That's right. So, and you're probably not eating sugar when you're chewing gum, I don't think.
No, I guess that's true.
So it probably works that way as well.
Okay, things like smoking, the effect that smoking has on teeth and gums.
It's more the effect on gums, smoking. It can reduce the blood supply in the mouth. So often you will get...
Is that caused through the gases or the nicotine?
That's a question probably.
It's just don't smoke.
Don't smoke, really. Often you can always tell when a person is a smoker by there's certain signs that you can see when you're looking in someone's mouth.
Brown teeth, perhaps? Brown
teeth is staining as well, but the gums take on a particular look about them. You can always tell. And if you ask somebody and they say, no, I don't. Actually, vaping now has taken over.
Oh, good point you're making, yes.
Especially with all the young teenage, that sort of age group, there probably hasn't been, I mean, I'm sure there's lots of research happening but that these teenagers need to be sort of aware of that. They think smoking's bad and
vaping's all right.
And really it's not at all. So
does it have a similar effect, what you've discovered so far?
Yes, it can do. It can do. So there needs to be a lot more awareness about that.
Well, then as we age, obviously some of our teeth literally wear out, I guess.
They do. And
people grind their teeth.
People grind their teeth. Everyone grinds their teeth to some extent, just some more than others. All just, life stresses these days. People, when they're dreaming at night, they're gnashing their teeth together. They're clenching during the day. They're clenching at the traffic lights.
I never thought of it that way.
Yes, so it all has an effect. So yes, you can wear your teeth away. So apart from, there's 3 types of tooth wear really as you age. So that the number 1 really was erosion that I was talking to you about, acid. Number 2 is tooth wear, actual clenching or grinding of your teeth, bruxism. And the third is abrasion. So often if you get a hard toothbrush or you brush too diligently in certain areas, you start wearing your tooth structure away, and that's where you can get quite significant sort of areas that the teeth become sensitive then.
Right. Now, some people suffer from bad breath, which is generally caused by, is it issues with the gums?
It is. There's a few different reasons for that. Dental ones, sometimes people get food traps in their mouth.
Right.
They're not
Starts
flossing.
to sort of pre-digest.
Yes, it can be from dehydration as well, just not drinking enough water. Sometimes it can be a gastric reasoning for that.
Right, so it's
but it's
deeper.
important to eliminate a dental cause in the first instance. And some people, come in and say, I've been told I've got bad breath. Can you, please check? So, and that's.
Now, how, as a dentist, do you cope with that? Because you've got to peer down the cave of.
It's that doesn't really.
You wear a mask.
We wear a mask. That's right. So
you put some smelly stuff in the mask.
No, I don't actually put some smelly stuff, but it's something that we can sort of keep. There's that barrier there.
Right. Is that difficult?
Not really. Not wearing a mask.
No. Do you see, like, in your mind, do you think, this is a problem that's deeper than this person perhaps realises? Do you need to send people to a GP or anything?
Yes, and I will always suggest that. People just need to be aware that if I think that there is a reason for them, yes, I will say, please go and see your GP. So it's just a matter of how you phrase it in a way that lets them know that that's probably what the best option is.
It's interesting, isn't it? And is that why there's such a long learning process for a dentist, so that they know about everything else in the body?
There is. There's a lot of general sciences that we would have started off, first and second year, and then there's subjects we would have done with the medical students as well, and then you go to localised sort of to head and neck, really the anatomy, and then really to sort of the teeth themselves. But there's a whole lot. There is a whole lot, and it's a gradual learning process. So it just it's sort of hard to pick it all apart now because it's just so ingrained.
Yes, because it's a whole thing
very
in your
ingrained.
mind.
Yes,
yeah, I get
yes.
Just wait there one moment.
Yep.
We have to take one more quick break.
Okay.
And we will be back to talk to Anna in a moment. Anna Koutsonikos has been my guest. She's a dentist and just been giving us some really good advice on as we pass through the different ages. So when you're old, what can you do if your teeth aren't good?
Oh, look, it's...
A bit general?
That's fine. You need to look after at all ages you need to look after your teeth, but there are things that sort of work that are a bit more difficult, I think, when you get older. Some people... And yet again, it varies. There's arthritis. People can't seem to hold the toothbrush as well as they would like.
See, that I understand.
They would not. They find it difficult to floss. A lot of people are on a lot of medications these days, which can have an effect. They can have a dry mouth and therefore no saliva or very reduced saliva.
To flush all
so
those
that's
things,
right. So very quickly the balance is shifted there. So they need to be very, very careful with their diet. Make sure that they don't have anything sticky that's going to stick on their teeth, and a dry mouth
I've never
with
thought
no
of it under those terms.
saliva that's not there to protect them. So
but we should look after our teeth even when we're older.
That's right. Well, it's very
checkups and things going.
For people that have looked after their teeth beautifully all their lives, it can become sort of difficult. And if they're in care as well, their diet is not their own. They get given. There's no choice there. So again, sometimes it's up to their family to make sure that they are brushing their teeth adequately.
Actually, that's such a good point.
That there's still. The fluoride in the water. There's high fluoride toothpastes that you can buy at the chemist, which can help if you need that extra assistance there.
And I've been delighted that you could do the program. I'm delighted from another point of view. I've always seen you in white.
Oh, have you? Okay, yes.
And here you are in colour.
Colour,
I
yes.
love it. And hiding behind a mask so often. But thank you very much.
That's all right.
I know
Thank
this
you,
was quite a
Malcolm.
thing for you.
That's okay.
So next time I come to see you, I won't be nervous either.
No, I'll try not to make you feel
but
nervous.
Thanks again.
Michael.
That was
Thank
brilliant.
you for having me.
And thank you very much for joining us on this episode. Hopefully what Anna has been talking about has given you confidence to look after yourself just that little bit better. So until next time on Our Time, keep yourself nice. Till then, bye.